Most people experience normal ups and downs, but true bipolar disorder is entirely different. It involves prolonged, distinct mood episodes that completely overwhelm those everyday emotional shifts, pulling you far past your normal baseline. On one end of the spectrum is a severe depressive episode, bringing a profound low mood, draining fatigue, and a physical heaviness that can make getting out of bed and functioning normally feel practically impossible. This diagnostic checklist shows exactly what happens on the other end of that spectrum. Looking at bipolar 1, we see manic episodes characterized by extreme grandiosity, racing thoughts, impulsive risks, and occasionally even psychotic features. If we move over to bipolar 2, the requirement changes. Instead of full mania, bipolar 2 requires major depressive episodes paired with what are called hypomanic episodes. Looking down at the severity metrics here, you can see that hypomania rarely causes major life disruptions like hospitalization, yet it still represents a clear, undeniable departure from your normal personality and behavior. Understanding exactly where your symptoms map onto this clinical spectrum is the mandatory first step. You have to know what you're dealing with before you can find the right provider. Because the depressive episodes are so severe, primary care doctors frequently misdiagnose bipolar spectrum disorders, especially bipolar 2, as standard unipolar depression. The reason comes down to human nature. Patients rarely go to the doctor to report their hypomanic episodes. When you're barely sleeping, talking fast, and getting a ton of things done, you don't feel sick. You feel like you're on top of the world. The problem is the inevitable crash. You go straight from weeks of high-energy risk-taking and peak productivity, slamming directly into weeks where you physically cannot get out of bed. Catching those extreme shifts requires an active, nuanced conversation with a licensed mental health clinician who knows exactly what to look for. For Georgians, highly affordable telehealth platforms are now readily available statewide. But this raises a practical question. Can an entirely online therapy service effectively treat a complex neurological condition? We know that treating bipolar 2 with standard depression protocols alone is often ineffective and can sometimes actually trigger manic episodes. The condition demands a highly specialized, targeted approach. To understand that approach, look at this treatment matrix. You'll notice behavioral therapy alone is not an evidence-based treatment for bipolar disorder. The biological requirement is clinical psychiatric medication, like lithium or valproate, which must be prescribed by a medical provider. These medications provide the necessary chemical stabilization in the brain to prevent severe, life-threatening manic or depressive spikes from happening in the first place. The behavioral requirement involves specialized psychotherapy, specifically cognitive behavioral therapy, interpersonal and social rhythm therapy, or family-focused therapy. While the medication addresses the chemistry, this therapy teaches you the practical, vital mood regulation skills, routine stabilization, and coping mechanisms needed to navigate daily life. Therapy cannot alter core chemical imbalances, and medications cannot teach you how to cope with stress. Therefore, bringing both together in a dual-provider approach is the only validated path to lasting stability. For the behavioral half of that equation, Coping and Healing Counseling, or CHC, offers an accessible solution serving all 159 Georgia counties entirely through telehealth. They have the clinical capacity to handle these complexities, fielding a diverse, culturally competent team of over 15 licensed therapists, including clinical social workers, expert professional counselors, and marriage and family therapists, treating both teens and adults. But as this process flowchart illustrates, there is a clear logistical trade-off. CHC's providers are licensed therapists, not medical doctors, meaning they cannot prescribe your mandatory mood-stabilizing medications. By choosing CHC, you give up the all-in-one clinic. You must build two separate branches of care, one for therapy, one for medicine. To bridge this gap, CHC therapists coordinate care directly with your prescriber to keep your treatment aligned. You have to weigh the administrative effort of managing two coordinated providers against the sheer accessibility and reach of a statewide telehealth network. That accessibility naturally leads us to the financial inputs required to sustain specialized, long-term bipolar psychotherapy. This cost comparison table reveals a major advantage. Under the Medicaid tier, CHC telehealth therapy sessions are covered at a $0 copay. For commercially insured patients using Aetna, Cigna, Blue Cross, UHC, or Humana, sessions range from $10 to $40 copays. Securing prices this low means making an environmental trade-off. Without a physical office to visit, you are responsible for securing a quiet, private space and a reliable internet connection at home for every session. As long as you have that secure environment, CHC's entire digital infrastructure is fully HIPAA compliant, guaranteeing your medical privacy remains protected over the internet. When you run the numbers, securing expert therapy for $0 to $40 a session makes the administrative hassle of finding a separate medication prescriber mathematically worth it for most Georgians. Managing bipolar disorder is a long-term commitment. The clinical reality remains absolute. Evidence-based treatment requires medication management and behavioral therapy working in tandem. We can use this quadrant chart to determine if CHC's specific telehealth model is the right fit for your situation. The ideal candidate lands right here in the top right corner. Budget-conscious Georgians who need expert therapeutic support and have a high tolerance for coordinating with a separate medical doctor. However, if you are currently experiencing an acute, severe crisis, this model is not for you. You require immediate inpatient stabilization, which goes far beyond outpatient telehealth. Likewise, if you demand a completely frictionless healthcare experience where your psychiatrist and your therapist share the exact same physical waiting room, you will need to look elsewhere. But if you are ready to take active ownership of your diagnosis, Coping and Healing Counseling provides an incredibly accessible, highly affordable foundation to build your long-term bipolar care team.